Major support for Carolina Business Review is provided by Grant Thornton. Operating in more than 100 countries, our tax, audit, and advisory professionals specialize in helping companies unlock their growth potential. Novant Health, bringing you world-class technology, clinicians, and care when and where you need it. And Sunoco, a global manufacturer of consumer and industrial packaging products and provider of packaging services with more than 300 operations in 35 countries.
At last measure, health care was close to 18% of the United States gross domestic product. Think about this. In absolute terms, total dollars spent in this country last year on health care was $3.5 trillion. Put another way, that is $3,500 billion on health care. Consequently, anything that big and undoubtedly that large will justifiably garner just as much scrutiny. Welcome again to the most widely watched source of Carolina policy, business, and public affairs. I am Chris William, and a generally accepted argument in the healthcare industry is the best way to compete is through scale and cooperation. These last 12 to 18 months have seen mergers or strategic partnerships between providers like South Carolina's Greenville and Palmetto Health, Bon Secours and Mercy, Wake Med and Duke Health, Cone Health, and Randolph Health, and probably the largest to date, if not nationally, then certainly here in the Carolinas, Atrium, formerly Carolina's Healthcare, and UNC Health. Will these planned mergers ultimately create lower cost and better population health? There is a lot to unpack in this dialogue, and we will, with Atrium Healthcare's President and Chief Executive Officer, Gene Woods.
Gratefully acknowledging support by Blue Cross Blue Shield of South Carolina. Please visit us at southcarolinablues.com. The Duke Endowment, a private foundation enriching communities in the Carolinas through higher education, healthcare, rural churches, and children's services. Barings, a leading global asset management firm dedicated to meeting the evolving investment and capital needs of its clients. Learn more at barings.com. On this edition of Carolina Business Review, an executive profile featuring Gene Woods, President and CEO of Atrium Health.
Hello, welcome to our program. Mr. Woods, welcome to the Carolinas. I know it's been here now for a while, but thanks for being on the program.
Well, thank you. Thanks for having me on the show. Yeah, it's been almost 2 years in May, so it's gone pretty fast. Yeah.
So, Gene, you've got this rebranding what has been the largest healthcare provider in the Carolinas for a while now. Rebranding it, have a strategic announcement with UNC Healthcare at the end of last summer. Navicent as recently as a Georgia proposal and intention there. So you've got all these huge strategic plans in place. Mm-hmm. You've got that going on. You've got those that are for it and those that are against it. How do you do all of that? How do you execute on that strategy, but also make sure that the trains run on time and everything is done day to day the way it should be?
Yeah. Well, first, again, thank you for having me on the show. Sure. As I said, it's been almost 2 years in May. And let me just start off by saying that I couldn't be more privileged to be at this organization at this particular time in healthcare, which, as you know and as you just described, is going through fundamental dynamic change. And I get to do it with among the most amazing people that I work with every single day. Talking about the concept of change, this is an organization that has embraced change going back to the Charlotte Memorial days. And if you think about where we're at today, we really could not have been the organization that we're known to be today without having visionary leadership, embrace change, big change, mm-hmm. and also execute on that change. I think what's different today is we're fundamentally at a different place in healthcare. You announced all these mergers, acquisitions, et cetera. And so the rate of change is much more significant than we've ever seen. And the playing field is fundamentally different as well. So you listed off a lot of things that we have embarked on these past 2 years. In one way, I'm just continuing the tradition that's been part of this organization, but albeit in a very different dynamic. There's the quote that Jack Welch says that if you're not moving your organization faster than the environment, then irrelevance is near. And so we're really embracing that change. And we want to be in the driver's seat, not in the passenger seat as we go through this. But what I step back and saying to your question, we've had some of our most successful years in terms of quality and financial performance. The main takeaway on the name change, on the new strategy, on the new partnerships, there's one thing that I tell my team is essentially what that all means, to boil it down, is we're doubling down on our commitment to patients in our community. That's really, if there's one takeaway that I would have people have, is that. And without, I'll give you a couple of specifics. We're recognized as a national leader right now for behavioral health and how we use telehealth to reach people in their homes if they need to. We're working with the police officers and YMCA to hotspot neighborhoods where there's youth violence and how we interact with those communities. We're one of the leading cancer institutes in the country. Every day, we have about 40 new cancer diagnoses that we treat, more than anybody in North Carolina. So really, all those changes, we're executing on those changes every single day, and that's really what our strategy, what our name change, what our partnerships are about, is how do we continue to double down on that commitment to patients in our communities.
Gene, you articulate it well. How do you make sure that you are focused on the end product to say, we're ultimately going to lower costs to the folks that end up using our services, and we want to make sure that the population health increases. So, I mean, there's a big gulf. How do you draw a line between the overall strategy of this organization that's got really big, a lot of leverage, no doubt? How do you draw that line back to the patient that walks through the door, the ER or the OR or urgent care? How do you make sure that that doesn't get lost?
Yeah, well, and just give you an example. We are, the Medicare, CMS, has designated us as one out of 2 organizations in the country that are modeling how we avoid patient harm and how we drive quality. So every single patient that comes in, we have improved our quality metrics that the government is telling us. But the most important thing is CMS, which is Medicare, is also telling me we've saved the government $100 million. So that's executing day to day. So what they're basically saying, this is the government, this is not our scorecard, saying you guys are part of what's called a HEN network. It's a hospital engagement network. And they're telling us that in terms of executing every day, which is all about patients, that we're improving quality and also saving the government money. So we have a team that's focused on that every single day, and our performance is showing that. But we understand that we have to do a lot of things in rapid succession and at the same time if we're to advance our mission. And so I'm proud of the team. We've got the right people in place. We've recruited additional folks on population health and other in our IT services, in our analytics, so that we have the right talent to continue to progress this organization forward.
You know, I want to spend just a little bit of time, but not a whole lot. I don't want to go down this road too far, because this, as I said at the beginning of the program, there's a lot to unpack here. A lot to get your arms around.
Right.
There have been some of those who spoke out publicly against this kind of merger, saying, gosh, this is big. North Carolina Treasurer Dale Folwell said, you know, want some guarantees. You've got public debt. Let's make sure that debt stays good quality. North Carolina Attorney Josh Stein, North Carolina Attorney General, said we can't prohibit it from an antitrust, but we want to make sure this is in the public's best interest. So I guess the question is again, Gene, how do you stay sensitive to those who would be cynical, skeptical, but also cynical to a merger like this, and not just satisfy them, but make sure that you hear it and they felt heard?
Yeah. Well, first of all, let me say that their questions are legitimate. I mean, they're asking questions. They should be asking questions. That's their responsibility. The challenge that we've had is that this is probably one of the most complex negotiations in the country.
Does that scare you away from it?
It doesn't. And this is why it doesn't scare me away, because the reasons why we thought this was better for North Carolina is a host of reasons. But I've had the opportunity now in the past year to spend time with the leadership team at UNC, Dr. Roper, his team, the chairman of the departments, and every single time I meet with them, I come away even more excited about who they are. They're a phenomenal organization, a tremendous organization. They're helping to discover new cures, as we are. So what excited us about this, and what has excited us going forward is, you take something like oncology, cancer, right? I mentioned that before. So we'll diagnose 15,000 new cancer cases this year. If you take the research combined, that's $70 million of research. So we started, Dr. Roper and I, saying, you know what, you put these two systems together, and they're what's called National Cancer Institute. So they are nationally recognized there before. And we said, if you put these two systems together, because right now we're investing in different infrastructure, wow, we could have, really, magic could be created, because nobody, and this isn't hyperbole, nobody would have to leave the state for cancer care. Now imagine that. My father died of multiple myeloma. I'll put a little plug in. I'm doing Dances with the Stars, Charlotte Ballet, next Saturday.
You agreed to that?
I agreed to that. A very weak moment. But I'm trying to raise money for multiple myeloma. If he were alive today, without doubt, I'd have him come here.
Yeah.
And if you take up the UNC and what their expertise as well, so those are the reasons why we wanted to come together, and I could go through a long list of that. That said, we understand there's questions. We're in the middle of a negotiation. If this goes forward, then we'll continue to be able to answer those questions, and we look forward to. If it doesn't, for whatever reason, we're still committed to the principles that we thought could make us stronger together, and that's rural care. We have said that if this does not come together, we would still form a partnership, public-private partnership, with others that were willing to figure out how we can advance rural care, not just in North Carolina, because we're in South Carolina and in Georgia, and work together on that. So the reasons why we thought this was a good idea was really that. It was about going back to my initial comment, how do we double down on patient care and our communities? And we'll continue to be responsive to the questions that people have that, again, we think they're legitimate questions. It's just a matter of where we're at in the process.
Last question on broad strategy. So 5 years from now, let's assume that 90% of what you've proposed in strategy and mergers and acquisitions goes pretty much how you expect it to be. What do you see Atrium being 5, 10, 20 years?
Yeah, I mean, I think that we will be recognized as a leading healthcare system in the country.
Largest?
You know, we're not in this just to be large. We do believe that with being large, there's economies of scale that we will take advantage of, and we intend to, and we've shown that we can. But it's not about being large, it's about serving more and more communities and doing that in innovative ways. We already have some leading practices. And when we're talking to other partners, we're actually going to learn from their leading practices. We're going to share ours, and we think we're going to get better. We won't need consultants coming in telling us how to improve care, because we'll have all the expertise within our systems.
So what fun is that if you can't have consultants? I want to read something for you. Dr. Mandy Cohen is the Secretary of DHHS in North Carolina, and I know you have spoken to her about it. Her job one, she was on this program, been other places publicly, saying the job one for her is the opioid epidemic. Right. University of South Carolina Gene Professor Dr. Christina Andrews had some pretty startling statistics. I want to read this to you and then ask you a question. She drew a connection between opioid prescriptions and unemployment. Half of the unemployed men between the ages of 25 and 54 years old, so 50% of that demographic are taking pain medication on a regular basis. She found that astounding. That clearly is in this orbit around opioids. How concerned are you about opioids? Is it, to use your term, how much of a hyperbole are those statistics? And what leverage could Atrium bring to bear on that issue? Yeah,
I'm extraordinarily concerned about opioids. It's the leading cause of death for people under 50. Think about that. And in 2016, I think there were 60,000. It's the larger category of drug over abuse, and I think there were 60,000 in 2016. It's up about 20% from 2015. So it's an epidemic right now in this country. We have stepped into that, and if you look at the Center for Disease Control, they're actually using us as a model for how we treat opioid patients.
Are you having success in that?
We are having very much success. So we have this led by our clinicians. We have this database, this data analytic capability. So for every 100 patients that come into our system, about 25 of them we get alerts that they may be in need of additional attention with respect to their opioid use. And half of those we're able to intervene and actually change their course of care to make sure that they do not suffer the consequences of opioids. So we just recently did a major conference nationally to show others what we're doing, what our clinicians are doing. But what Mandy, and it's good to have her in the state because she's a really innovative thinker, and I think we'll be able to work with her on this issue. But it's not just health systems. It's health systems working with the police departments, working with the health department, working with the schools. So this is an all-in effort, and we're comfortable that we have the clinicians that are dedicated to this and are being nationally recognized for our work, but it can't be done by one particular organization. And I think with her leadership, with the leadership of others coming together, we can make progress. But I think people have to realize it's going to be, a pretty significant effort daily to really reverse what is a national crisis right now.
And not to be too cute with a turn of a phrase, but is a hospital a first responder when it comes to an opioid issue, an opioid crisis?
Yeah, we're first responders on a lot of issues, but certainly when people show up in our emergency rooms in crisis, we have to not only get them well and deal with the immediate crisis, but for us what's important is what happens when they go home. What happens when they go home? And what type of support do they have at home? I mentioned behavioral health. One of the proudest things I am of this organization is how committed we are to caring for people with mental illness, which is 1 out of 4 in this country when they leave our emergency rooms. So our virtual care program, we actually can reach people in physician offices. We reach people at home. I was touring one of our behavioral health hospitals on Randolph this week, talking to
Charlotte,
and talking to the people there, and we have now we're piloting the iPhone. So when people are a patient and they go home and they need meds and they need to make sure that they're on the right meds, we can just dial them in through the iPhone, and we have a physician that's working with them at home. And so those are the important pieces as well, because we're first responders when they come to the emergency room, but we have to care for them also when they leave our walls. Otherwise, what happens? They show right back up into our emergency rooms. So that's where the community network is really, really important, and because our goal is to keep them out of crisis. But again, it's an effort that requires a lot of people working together.
So in healthcare policy in the United States, it seemed like there was an initiative a few years ago that behavioral health would again come to the front and there'd be some kind of support from Congress. Kind of died away. You think tragedies like Parkland, Florida, will bring back the idea of mental health care and behavioral health? Do you expect that this is going to be an issue?
I really hope so. I think, and I see movement. I would say 5 years ago, I'm not sure the issue of behavioral health and mental health was front and center. Now, almost every conversation I have, this one included, people are talking about mental health. So I think, like cancer at one point, it was people didn't want to admit they had cancer. And it's the same thing for mental health. I think people are much more willing to say that they need help, and it's coming out of the shadows, if you will, and it's only that way that we can address it.
2 questions about national health care policy, Gene. First of all, where would you expect it to be in the next year, short term, and then in the intermediate term? Is there anything that would be a concern to you that if there were a zig or a zag in healthcare policy in the United States that could, and this is my term, scuttle any plans that you have for any of the current mergers or any strategic growth that you have?
We're at a very interesting time in healthcare policy in this country. The Affordable Care Act is still the law of the land, but then you have individual mandates and other pieces that are no longer part of that. So we're kind of in the middle of not really having a bunch of clarity in terms of how the policy piece of this is going to be put together. And what we're saying is we want both sides of the aisles to work together and figure this out, because we as providers, every day we got to figure out what the rules of the game are in order to deliver care to our community. We're saying just tell us the rules of the game, we'll play by them. But if the rules of the game are different tomorrow and different the next day, then it's hard to really figure out how to predict how this thing might impact, and it has some very significant impacts on our work. that said, let me respond to your question in a couple ways. One is, I think there's a lot of congruency around the fact that we're in a time in healthcare of regulatory overload. So the regulatory burden on healthcare providers is really significant. Last year, there's about 30,000 pages of new regulations that came out, and we're trying to figure out, we have to implement all those. The year before, about 25,000. So what we're working with the administration, understanding that the policy debate is still being discussed, is how do we work together to really decrease the regulatory burden? Any particular hospital that you go to is spending $8 to $10 million a year just trying to deal with all of this, and some of it doesn't have direct impact on patients. You know, this is some old regulations.
No matter what size, what revenue, it's 8 to 10 million.
It's the average. It's the average if you take all the hospitals together. So what we're focused on as the policy debate happens is how can we simplify those regulations so that they can not add costs, and especially those that really don't add to the benefit of caring for patients. So that's where we're at. Take all that aside, it goes back to what I tell my people, because they ask the same questions. I was chairman of the American Hospital Association, so they say, you have an inside view on this.
How did you do that? How did you do the AHA and Carolina's Healthcare Atrium? Not to get you off on the subject, but you know, that's Herculean as well.
Great team. And no sleep.
Yeah, I'm sure. We've got about 5 minutes left, and you know, so many things to go through. Medicare, Medicaid, Medicaid specifically, federal dollars have been refused in North and South Carolina for a long time now. Are you actively advocating that the General Assemblies in both states reconsider, and would you expect that they're closer to accepting some form of federal payment? Yeah.
Well, let me just step back on the Medicaid program, because we had a lot of conversation nationally last year. So we have 70 million people on Medicaid in this country, 70 million. And I don't know that people fully appreciated, there's 2 million veterans, 40% are children. So I just want to, when we talk about Medicaid, we talk about Medicare, it's really important to put a face on the people that we're serving, and those are the people that we're serving. And so the question is, how do we continue to expand access? We got to do it in the right way. The legislators have legitimate concerns about making sure the cost, we do it in a cost-efficient way, and those are legitimate concerns. So our conversation is, how do we balance that fiscal responsibilities that they have and take seriously, as we with expanding access? There's I read an article on this farmer in Alamance County. He's been farming for 40 years, and farming is the 6th most dangerous profession in the country, behind actually more dangerous than police officers and firefighters, and I don't think I knew that. And his concern was, with all this politics going on, he's just worried about making sure he can maintain his access to insurance, because otherwise that's the #1 way that some of these small farmers go bankrupt. And so when we talk about Medicaid expansion, it's affecting real lives, like this farmer in Alamance County. I think his name was Alex Hicks, if I remember correctly. And so it's not just about health, it's about economic well-being of farmers, of rural areas, and they're all tied together. And so that's the argument that we're making, is let's be fiscally responsible about the program, we have to, but also let's do it in a way we're smart enough to be able to figure out how to do that and expand access to the more people that need it.
A couple minutes left. You are half African American, half Spanish. Not necessarily where your loyalties lie, but how do you lead being multiracial? When diversity comes up, how do you think about it?
Well, it's actually one of the reasons why I'm here at Atrium Health. We just redid our mission last year, our mission statement, and it's to improve health, elevate hope, and advance healing. I took that to the board, and the board said, there's one thing that's missing. I said, I think we got it. You know, I think we touched on all that health, hope, and healing. And they said the one thing that's missing is for all. That's coming from our board, and that's really what's attracted me to this organization. It's
because they saw that, and you didn't have to bring that up.
Because they saw that, and I saw that coming into this organization. You know, going back to Charlotte Memorial, going back to if you just were to sit in one of our hospitals and saw our teammates, our leadership, Forbes named us as one of the most diverse organizations in the country. Others have as well. So we are inside of Atrium, we really are, I think, the best of what America can look like when people from all walks of life come together, and the people that we serve are the same. And that's why I'm here. That's why I'm proud to lead this phenomenal organization.
Please come back when we've got more time, because we left a whole bunch of stuff unturned here. And welcome. We wish you the best for everyone involved. Thank you for being here, and please come back, Gene. It's easy to say this, and I want to read something. Billy Graham passed away recently, and why that's important to all of us is because he was a very unique personality. There's no doubt about it. A favorite son of Charlotte, a favorite son of the Carolinas, remarkable personal responsibility, remarkable personal character. His brother-in-law, Leighton Ford, said he was the star preacher with the stylish double-breasted gabardine suit, flowery ties, piercing blue eyes, stabbing finger, and the voice with a touch of Carolina thunder. This man will be missed. Truly, and our special sympathies to his family and all who knew him well. Thank you for watching our program. I'm Chris William. Until next week, good night.
Major funding for Carolina Business Review was provided by the Duke Endowment, Barings, Grant Thornton, Novant Health, Sunoco, Blue Cross Blue Shield of South Carolina, and by viewers like you. Thank you. Promotional consideration provided by Business North Carolina Magazine. For more information, visit carolinabusinessreview.org.